Hello, Ms. McLaren. My name is Mallory. I'll be doing your physical exam today. During this time, I will be inspecting you, where I will just look at your body for any lesions or masses. I will also be palpating and percussing. Percussing, I will take my finger and I will tap on it to hear certain sounds. Palpating, I'll just kind of have to touch you. During that time, I want you to tell me if you feel any tenderness. I will also be auscultating, where I take my stethoscope and listen for certain sounds. Before we get started, I'm going to wash my hands. While I wash my hands, I do want to state that upon assessing Ms. McLaren today, her body size and proportion is appropriate for her height and weight. Upon assessing her gait when she walked in, it was steady with no involuntary movement. She is dressed appropriately for this situation with good hygiene. She is oriented ×4 today, and we've already done our vital signs. So I'm going to go ahead and get started. I'm going to start with cranial nerves. Cranial nerve number 1 is olfactory. So can you close your eyes for me and close off one nostril? And tell me what this smells.
Peanut butter.
Okay, and close off the other one for me. And can you tell me what that smell is?
Coffee.
Okay. Both of those were correct. So cranial nerve number 1, olfactory, is intact. Next is cranial nerve number 2, optic. We've already done this today with the Snellen eye chart. Her vision was 20/20 with corrective lenses. She does wear contacts. So cranial nerve number 2, optic, is intact. Next is cranial nerves number 3, 4, and 6, oculomotor, trochlear, and abducens. I'll do this with the cardinal fields of gaze. Can you look at my point and follow with just your eyes? Okay. Cranial nerves number 3, 4, and 6 are intact. I'm also going to test for accommodation at this time. Can you look over there, Courtney? And look back here and follow with just your eyes. Accommodation is intact. The pupils do constrict from a 4 to a 2. I'm also going to test for consensual and direct light. So just look straight for me. Consensual and direct light is intact. Next is cranial nerve number 5, trigeminal. Can you close your eyes for me? And tell me when you feel this on your face.
Yep.
Cranial nerve number 5, facial. Cranial nerve number 5, trigeminal. Can you chew for me? And clench down. Cranial nerve number 5, trigeminal, is intact. Next is cranial nerve number 7, facial. Can you smile for me? And can you frown? And can you pull out your cheeks? Okay. Can you stick out your tongue? Open your mouth. Adequate saliva is intact, so cranial nerve number 7, facial, is intact. Next is cranial nerve number 8, acoustic. Can you close off one ear and close your eyes? I'm going to whisper a word into your ear. I want you to tell me what it is.
Tuesday.
Okay. The other ear.
Thursday.
Okay. Those were both correct. So cranial nerve number 8, acoustic, is intact. Next is cranial nerve number 9 and 10, glossopharyngeal and vagus. Can you take a sip of water for me? Okay. At this time, I would also test the gag reflex, but we're not going to do that today. Cranial nerve number 9 and 10, glossopharyngeal and vagus, are intact. Next is cranial nerve number 11, spinal accessory. Can you push up with your shoulders? Okay. Cranial nerve number 11, spinal accessory, is intact. Next is cranial nerve number 12. Can you stick out your tongue for me? No involuntary movement noted. Cranial nerve number 12, hypoglossal, is intact. Next, I'm going to move to the head. Head is normocephalic. I'm looking and inspecting the hair for any discoloration, texture. Texture is fine. Hair color is brown with blonde highlights, no discoloration noted. I'm going to inspect the hair for any nits, masses, or lesions. None noted. I'm also going to palpate for any masses or lesions and tenderness. Tell me if you feel any tenderness. None of those were noted. No tenderness noted. Next I'm going to move to the eyes, and I'll also test the, I will inspect the eyes for any discoloration, masses, or lesions, any tenderness. I will palpate the lacrimal ducts and the frontal and maxillary sinuses. No masses, lesions, or discoloration noted, either symmetrical on the face. So if you feel any tenderness. No tenderness noted. I'm going to lacrimal ducts, no drainage, no excessive tearing, no tenderness. Frontal and maxillary sinuses, no tenderness noted. I've already tested for accommodation and consensual light. Her sclera is white, conjunctiva is pink, iris is blue, pupils are a 4 millimeter and black, and they did constrict to a 2 milliliter with accommodation and consensual light. Next, I'm going to move to the oropharynx. I'll put on my gloves for this. I'm going to inspect her lips. They are pink and moist. Pink is, tongue is pink and moist. Buccal mucosa is pink and moist. No cavities or malocclusions noted. No lesions or nodules noted. There is a filling on the left side. No tonsils noted. Uvula does rise midline. Rhoda ducts are intact. Hard and soft palates intact with rugae on the hard palate. Next I'm going to move to the nose. It is symmetrical, or it is positioned midline. I see no drainage or exudate. No masses or lesions noted. I am going to inspect the inferior and midline turbinates. They are intact and a pink color, no inflammation, exudate, or drainage noted. Now I'm going to move to the ear. I would do this bilaterally. I'm inspecting for any masses, lesions, any drainage. None noted. I'm going to palpate the auricle and the tragus for any masses, lesions, or tenderness. None are noted. She does have one piercing. I am going to select the appropriate size cover for my otoscope. I'm going to inspect the ear. I did, there's no drainage, exudate noted. I did visualize a early gray tympanic membrane. The cone of light was at 7 o'clock. Following that, I did visualize the ubum, manubrium, and short process. Next, I'm going to move to the neck. The neck is proportioned and symmetrical. I am going to palpate the thyroid gland. Can you swallow for me? Thyroid gland is unpalpable, which is normal. I'm going to palpate the carotid arteries one at a time. That would be a 2+. And also a 2+. Now I'm going to also take the carotid arteries for any bruise. Take a breath for me. Hold it. And then take a breath. And again. Okay. No bruise noted. I'm now going to assess the anterior and posterior chest. Inspecting it, there's no lesions or discoloration noted. She does have a large tattoo on the right side around to the abdomen and a smaller one midline lower back. I'm going to test for symmetry. Can you take a breath for me? Chest rises symmetrically. Next, I'm going to test for tactile firmitis. So I'm going to put my hands on you. I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
No tactile firmitis noted. Next, I am going to percuss. I would expect to hear resonance. Resonance noted. I'm now going to auscultate. I would expect to hear bronchovesicular sounds near the spine and vesicular sounds throughout the rest of the lung fields. I just want you to breathe normal for me. Lung sounds are within normal limits. Now I'm going to move to the anterior chest. Again, I'm inspecting, no lesions or discoloration noted. She does have a piercing at the navel with a tattoo on her right side coming around to her abdomen. She does have a tattoo on the left upper shoulder, and as well as one on the left side. Again, I'm going to check for tactile firmitis.
99, 99, 99, 99, 99, 99, 99, 99.
No tactile firmitis noted. Next, I'm going to percuss. I should expect to hear resonance again. Sounds are within normal limits. Next, I'm going to auscultate. I would expect to hear bronchial sounds near the bronchial tree, bronchial vesicular near the sternum, and vesicular throughout the rest of the lung fields. Just pretty normal for me. Lung sounds are within normal limits. Excuse me. Next, I'm going to palpate the PMI. PMI within normal limits. We can turn around. Next, I'll move to the heart. I'm going to inspect for any heaves. No heaves noted. Set up. Next, I will auscultate the heart valves, the aortic, which is at the second right intercostal space, the pulmonic, which is at the second left intercostal space, the Erb's point, which is at the third left intercostal space, tricuspid is fifth left intercostal space, and mitral is fifth midclavicular line intercostal space. I would do this in the supine, sitting erect, leaning forward in the lateral positions with the diaphragm and the bell. Valve sounds are within normal limits. Have you lay on your left side for me? I'm going to assess the apical and radial pulse. No difference noted. Have you lay on your back line. I'm now going to move to the abdomen. I see no masses, nodules, or lesions. Again, she does have the tattoos on the sides and the piercing. First, I'm going to auscultate for bowel sounds. I would listen for a full 5 minutes in each quadrant before saying bowel sounds are absent. I'm also going to auscultate the aorta, the renal, the iliac, and the femoral arteries. Bowel sounds were present. Next, I'm going to percuss. I would expect to hear tympani throughout the abdomen. Percussion sounds are within normal limits. Next, I will palpate lightly for any masses or nodules. Tell me if you feel any tenderness. No masses, nodules, or tenderness noted. Now I'm going to palpate a little bit deeper. Again, tell me if you feel any tenderness. No tenderness or masses noted. Next, I will palpate the liver, spleen, and kidneys. Tell me if you feel any tenderness. All were non-palpable, which is normal. Can I get you to set up? Next, I'm going to check range of motion of the upper extremities. I'm going to do this while checking for crepitus. So can you raise your arm up for me? And back down and out and back up. Okay. And your elbow, can you bring it up for me? And stretch it out and back in. And your wrist, can you bring it up and down and side to side and twist it around? Roll it. Okay. And your fingers, can you wiggle them and bring them out and in? Okay. I'll do this bilaterally. Range of motion is intact. No crepitus noted. Can you stand up for me? Turn this way. I'm going to inspect the concavity of the cervical spine, convexity of the thoracic, and concavity of the lumbar, which is normal. Can you put your arms like this and bend down for me? I'm going to inspect the spine for any scoliotic deviation. None noted. So you can stand up for me. And can you go frontwards and backwards and side to side? Range of motion is intact. Can you patch your legs for me? I'm going to check for coordination. Okay, and touch your fingers to each other. Okay, and hold your arms out and touch your fingers to your nose. Okay, and bring your heel to your. Okay, coordination is intact. Can you walk with your heel to toe for about 10 steps? Tandem walking is intact. Can you stand with your eyes closed and your hands at your side for about 20 to 30 seconds? Okay, Romberg sign is negative. Can you close your eyes and hold out your arms like this for about 20 to 30 seconds? No Palmer drip noted. Okay, you can have a seat. I'm now going to back at the abdomen. Before that, I would verbalize that we would also do a breast exam. I would have the patient put her hands on her waist and lean forward, checking for any dimpling or induration. Also have her raise her arms up. Using the balls of my fingers, I would do a breast exam in a systematic manner until I got to the nipple, where I would take my forefinger and my thumb and squeeze to assess for any drainage. I would also palpate the axillary and lateral and pectoral lymph nodes along with epitrochlear. I would also palpate for the lymph nodes, preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. All were non-palpable, which is normal. Now I'm going to test the range of motion for the lower extremities. While doing this, I will also check for crepitus. Can you bend your knee out for me and back in, and then out. Bring your leg up this way. Okay, and back in, and cool. Can you bend it up for me and down? Wiggle your toes. Bring them out and in. Okay, and my back for me. Can you bring your hip out, your leg out, and back in, and up, and down. I would do this bilaterally. Range of motion is intact with no crepitus noted. Okay, so we're doing this one. And push your hands out like this, and push against my hand, push my hands in, and push my hands out. Okay. Strength bilateral is intact. Can you push against my hand? And push against my hand. Strength again, bilateral. I'm gonna test dull and sharp sensations. So can you close your eyes for me? I want you to tell me if what I'm touching with is sharp or dull. Sharp, dull, sharp, sharp, dull, sharp, dull, dull. Okay, dull and sharp sensation is intact. Close your eyes again for me. I want you to tell me if I'm touching you with one or two things. 1, 2, 1, 1, 2, 2, 1, 1. 2-point discrimination is intact. Close your eyes again for me, and I want you to tell me when you can't feel this vibrating.
I can't.
Okay. Vibration sensation is intact. Next I'm going to test the reflexes. We have brachial, I would grade that as a +2. Next is, that was bicep, sorry. Next is tricep. Tricep is intact, and I'll grade that as a +2. Next is brachioradialis. That I would grade as a +2. Next is patellar and Achilles. I don't want you to hit me. Just relax your legs for me. I would grade that as a +2, the patellar. Next is Achilles and athletes, I would grade that as a +2 as well. I'll also test the superficial reflex. Superficial reflex is negative. Next, I will move to the peripheral pulses. I would do the reflexes bilaterally as well as the peripheral pulses. So we have brachial. Grade that as a +2. And radial, a +2. Ulnar, a +2. Femoral, +2. Popliteal, +2. Dorsalis pedis, +2. And posterior tibial, +2. At this time, I also want to verbalize that I would do a genital exam on both males and females. I would do I would inspect for condition and distribution of the pubic hair. I would also, for the male, I would inspect the penis for any masses, nodules, or discoloration. I would inspect the scrotum for any masses, discoloration, or nodules. I would palpate the penis for any masses. I would inspect the urethral opening, see if there's any drainage noted. I would palpate the scrotum for symmetry and masses. I would palpate the inguinal opening. I would follow it along behind the scrotum, behind and under the scrotum, for any masses or nodules. I would do a digital rectal exam and palpate the prostate gland. It should be a firm heart-shaped gland. And I would also check for hemorrhoids. For a female, I would inspect the labia majora and minora for any for shape, size, discoloration, any discharge. Inspect the urethral opening for any discharge. I would inspect the vulvar for any abnormal bulging or discoloration, and I would inspect for hemorrhoids. At this time, I would conclude my physical exam.